risks in anxiety disorders. Well, a couple of months ago, Professor Mesut asked me to prepare a presentation on this topic, and I thought that it would be quite an easy presentation. However, when I checked the literature, I saw that there is not a high number of studies carried out on this topic. This is a saying of William Harvey. In every emotion, in all the negative or positive emotions, there will be an effect on the heart, and this situation actually distorts the natural functioning of the heart. This is quite a crowded slide, but in the end, we can say that anxiety is centered on the pituitary in the brain, and the sympathetic nerve system is activated. As a result of that, we see some results, and these results increase the cardiovascular vulnerabilities. What those conditions can be? Well, the autonomous nervous system can become dysfunctional. Insulin resistance can increase because of the HPA and sympathetic nervous system activation, and on the basis of cortisol, obesity can increase, hypertension, inflammation, and also there's an increase in platelet activation. This is particularly related to the vascular part, and this may cause some vascular problems. Plaques are formed easier, and endothelial dysfunction is seen as a result, and in the end, again, when we analyze the situation in vascular terms, the risk is increased. So when we look at the anxiety and cardiovascular risks, we can mention that list. This is an important slide. It's not only particular to the anxiety, but to all the mental disorders. So I just wanted to show all the other disorders as well. When compared to the general population, those with mental diseases have different mortality rates. Of course, the acute myocardial infarction, circulatory system disorders are the basic problems, but for all the disorders, if there is a mental disorder in the person, it is a specific risk factor per se. And here you can see the risk factors that are increased in the basic mental disorders when compared to the normal healthy population. When I scanned the literature, I found this data. It's a very important data, I believe. That is why I included that in my presentation. In middle-aged adults, together with the BMI increase, the brain volume is decreased, and they are under risk of cognitive dysfunction in the future. Autonomous nervous system becomes dysfunctional, and the HPA axis is dysregulated because of chronic anxiety, and the person gets put on weight. It's very important. It's an important problem, particularly in our country in the last 5 to 10 years. It has actually a negative impact on everything, but as the BMI increases, then the brain volume is decreased, and this is a very important data. If the BMI is 20, and when you compare that person with a person with BMI 40, then we can see a decrease in the brain volume up to 20 cubic centimeters. Metabolic syndrome is an important factor in this concept, and when we are using antipsychotics, of course we are talking about metabolic syndrome, but it's very easy to make the diagnosis, and depending on the antidepressant, we are also using the antipsychotics indirectly for the depression. And then the metabolic syndrome is diagnosed very easily, as I said. For central obesity, it is 94 centimeter of waist circumference for men and 80 centimeter and over of waist circumference for women. And when you look at the high triglyceride levels, it is 150 milligrams. So, and if it is higher than that, or if the person is taking medication for that, then we can say that that person has metabolic syndrome. So it's quite easy to diagnose. I'm going to talk about some studies, and then I will mention our studies, and then I'll finish. Well, the correlation between anxiety and cardiovascular diseases go back to the 1870s, and particularly the irritable heart is particularly used by Da Costa, and sometimes it is used also for the panic disorder patients, and when there were no criteria for these disorders. Tachycardia and palpitation, which are the somatic indications of anxiety, are also important symptoms in cardiovascular diseases. And also, anxiety-related thoughts and decreased autonomic variety is also causing the parasympathetic nerve tonus decrease, and also the sympathetic nerve tonus is affected by this system. Anxiety and cardiovascular diseases and cardiac mortality, when you look at these concepts, the anxiety is an independent risk factor for cardiovascular diseases and cardiac mortality. And in ICD-8, it is said that between 18 and 20 years of age, anxiety is a cardiovascular independent risk factor in male, and it is a factor that can be changed. And also, anxiety is affecting the platelet reactivity that is related to serotonin, and also it has an effect on the platelet functions if the anxiety has very remarkable symptoms, and it is related to the coronary artery, that is, it is related to the vascular system. The plaque formation is triggered by the anxiety and related symptoms. Panic disorder symptoms are overlapping with the MI symptoms, and sometimes they are confused. And also the anxiety disorder that is mostly correlated with cardiac diseases is the panic disorder, and also it is increasing the risk of MI and ischemic events. And the panic disorder rate in hypertensive patients is 13%. It is very important because I am also dealing with the behavioral developmental therapy. And the basic approach is that anxiety is not harmful. However, we are teaching that to the patients. However, this information, this data is actually in contradiction to what we do. We are lying in a sense, but in behavioral developmental therapy, we are trying to teach the patient that anxiety is not harmful. The sympathetic tonus increase is not so important. It's going to reach its peak, and then it's going to be stable, and then it is going to be decreased, and parasympathetic system will be increased. I mean, we are teaching this to our patients. However, unfortunately, these data are in opposition to what we teach. On the other hand, antidepressant drugs may have some cardiac side effects, and particularly tricyclic antidepressants are used quite frequently in our clinical practices. And actually they can prolong the QT time, and they may increase the risk of arrhythmia. And also the drugs, these kinds of drugs that are used in the treatment of anxiety, and antipsychotics and antidepressants, which are used sometimes in add-on treatments, may cause the weight gain, and indirectly they increase the cardiovascular disease risk. Among the drugs that we use, among psychotropic drugs, I searched whether there is one which does not cause weight gain. We have aripiprazole partially, and fluoxetine are the drugs that may not cause weight gain. And at the end of 1 year, the patient is keeping the same weight, and we suggest that it does not cause weight gain. However, in practice, sometimes we cannot confirm that. But we have many drugs that are causing weight gain. So this is these are the options that we have in hand. And also in antipsychotics and antidepressants, we have serious weight gain, and sometimes they develop glucose intolerance, or they have diabetes in the end. And I would like to make a self-criticism here. We accept the patients as if they are primary diabetic patients. It's like the type 2 diabetes. However, we most of the time neglect or oversee our own contribution to that. The antipsychotic dependent diabetes is seen more and more. What should we do? Well, personally, I'm trying to be proactive. And I talk about the side effects of the drugs to the patients. And I do not say that it is directly causing weight gain, but it is going to increase your appetite, and you will gain weight. So you have the control. You can have 1 hour of jogging or walking in a day. So I suggest them to walk every day for 1 hour. And anxiolytic and antidepressant effects can also be achieved by walking as well. So I'm talking about these options, but other than that, we do not have anything in hand. So this is a serious problem with antipsychotics, but most of the time antidepressants are neglected. So almost all of them cause weight gain. Only bupropion is here, and risperidone has a low risk for weight gain. But when we can say that there is no risk, it is bupropion, including the SSRIs. We do have this risk. Paroxetine 2, for instance, it is used particularly in the treatment of depression. Then naproxen can have 1 or 2 positivity. But we can say that there is no drug that does not cause weight gain. So we have to include we have to enlarge our approach when we are treating the patients. This is an interesting study. In social terms, the well-being and the high quality of life and cardiovascular diseases are correlated in this slide in men and in women. As they decrease, the risk is increased. This is even a more interesting slide. Marriage satisfaction and carotid plaque presence and progression is taken at hand. If you are not married, then you are under moderate risk. If you have a satisfied marriage, then it is decreasing the risk. But if you have a marriage in which you have conflicts, then you have a worse result than when compared to a single person. And also we had some specific contribution to the literature. This is Psychosomatic Medicine Journal. This is a study that we carried out with the cardiology department. Panic disorders. In panic disorders, we are talking about increase in autosomatic activity. We checked the P-wave dispersion levels. And this is a risk factor for arrhythmia. One of the risk factors for arrhythmia. And we had 40 healthy and 40 healthy individuals who applied our outpatient clinic. And we have the minimum and maximum values, and P-wave dispersions are increased significantly when compared to the healthy controls. It shows that they are under arrhythmia risk. We also check the patients with hypochondriasis, because automatic compression and in hypochondriasis also has the etiology that is related to these systems, and it is meaningfully related to the risk, and hypochondriasis is particularly closely related to the panic disorder. And still these patients are under risk of arrhythmia. QT dispersion increase is more related to the sudden death. That is, the difference in QT intervals on 12 leads are taken and measured, and in panic disorder patients these differences were quite high when compared to the healthy controls. Therefore, the panic disorder patients are in higher risk in terms of sudden death. In the OCD patients, we also did an analysis. In OCD patients, P-wave dispersion is found to be significantly increased. And we checked plasma adiponectin levels in the patients. Adiponectin is a neurohormone that is cardioprotective. If it is decreased, then cardiovascular risks, particularly arrhythmia risks, are increased. Particularly in obsessive-compulsive disorder patients, we had 23 of them, and significantly, as you can see on the screen, the P level is decreased when compared to the healthy controls. And the QT, excuse me, says the speaker, the P-wave dispersion can be explained because of its increase in the patients, OCD patients, when compared to the healthy controls. And the neurohormone, which is cardioprotective, is decreased in the OCD patients. In conclusion, in anxiety disorders, cardiovascular risks should be considered. I mean, we should keep them in our minds. In anxiety disorders, the role of the treatment itself may increase the cardiovascular risk. Here we particularly focus on the weight gain. And also the anxiety disorders were open to cardiovascular risks because of the nature of the disease itself, as we can understand that from the studies. Thank you very much for your attention. Thank you. Well, in